The Ron G Morning Show, every Monday through Friday at 7 a.m. only on WSAN Radio, the soul of America. All right, good morning, everybody. Good morning. We are here again for another hour or more. It depends on how much she has to say. But right now, I have this young lady who I met for the first time on Saturday. You know,
Right.
isn't it something else how God can bring people together? And that, I did some research on you. Know that, don't you?
Okay, well, tell me,
Yeah.
what did you find out?
Is it true that you're a doctor?
Yes, sir. My
See?
name is, yes, I do have my doctorate degree in
Hmm.
nursing practice. Yes.
Right. So it's not just Gloria Wright, it's Dr. Gloria Wright.
Thank you.
See,
Yes.
see, see, she didn't tell me that, but I look around, I nosed around and
Okay.
just see it. And we talked for a little bit. And
Mhm.
then she came at me and I text her to send me more information. She sent me like
Yes.
a billion flyers. No, it wasn't that many. I always say my version sounds better.
Hey, so
But
long as it juices it up in a good way, we're fine.
yeah, and so I was intrigued by your flyer. I
Hmm.
wish I could make it, but unfortunately I had a previous engagement
Mm.
that's taking place that day, and that's the reason why we're getting you on here.
All
So
right.
so Dr. Wright, you want to tell us what you're doing and what let me go back and ask this question right.
Okay.
First, meeting you for the first time, anybody meets the first time, what do they see and get from Dr. Wright?
Whew. Okay, so hello, everyone. My name is, yes, Dr. Gloria Wright. I am by profession a psychiatric nurse practitioner, which means basically I do mental health services. And I'm fortunate to be the founder and CEO of Insight Mental Wellness. It is an outpatient practice here in San Antonio where we cater to patients from age 9 all the way through 99. We've been around going over about 8 years now. It's been a blessing. Clinic is focused on medication management, counseling services, and also advanced therapeutics to include esketamine and transcranial magnetic stimulation for those who are having treatment resistant uh, psychiatric concerns. However, I do wear several hats, right? I have been from my childhood an entrepreneur, and I have always enjoyed getting myself busy in a way that benefits the community.
Hmm.
And for that reason, over the course of my life, I've always enjoyed teaching. Here at Insight Mental Wellness, we've been fortunate to work with, I would say, well over 50 students who are nurse practitioners, physician assistants, um, medical students, counselors, and all the works, and help them to get to their level of expertise in the medical field. And together with the team we have here, we also mentor those who are curious about the medical field. That led me with my background also teaching as a faculty for the master's level program with the University of Texas at Rio Grande Valley. I went ahead and said, you know what, this is something that I've always enjoyed doing. Teaching is part of me. I love it every time I engage with it. So that birthed the Pinnacle Career Center, right? And the Pinnacle Career Center is our academic arm where we right now have been certified by the state to offer assistant program to the public. And now we're moving into the medication assistant and phlebotomy and pharmacy tech and the likes. So that's that. And then there are several others. I don't want to go into all right now because this is just like I say, so many hats to me, but those are at least the main part. And I really enjoy what I do. I enjoy, collaboration. It's one of my biggest uh, uh, part that I enjoy engaging with. And so this is an opportunity that I take, I take a lot of appreciation too, because it gives me the privilege to also share about what I do and what I love with the public as well. So
Okay.
that's
And,
me in a nutshell.
yeah, and I'm telling you, she was out the Want to Go Fit Forth annual wellness event that took place. And that's
Yes.
where I met her at. She was one of the panelists up there. And I tell you what, that place, we never had that many people in there before. And for you to step up and be on the panelist as an expert, that meant a lot to a lot of people out there because they were asking some questions.
Yes.
I'm glad they interact. Some of the hardest thing is people to interact. You get up there, you talk
Hmm.
about something. I think most of the time they're scared to ask a question because they think it's a stupid question. But no question
Hmm.
is that if you don't know the answer.
No. I always say the only time you will have a stupid question is if you fail to understand what the answer is,
Okay, I
right?
like that.
So long as you give yourself the chance to understand, oh, okay. Now, for you, it may sound stupid, but the fact is, there is an answer to it, right?
Mhm.
And so at that moment, you might feel like, duh, why do you think they make, you know, computers for dummies? This for fifth graders? Because they know there
Yeah.
are people who level of comprehension may be that. And no matter how much you think you know, in certain areas, it's not your expertise. You still need someone to help you understand it. So
Hmm.
I like that part. There's never a stupid question. And going back to the event on Saturday, I actually was there back in 2024 and got to witness the whole setup and I loved it. I missed out the one last year, but I'm glad I was part of the panels this year to
Hmm.
talk about healthcare in general.
Okay. And to piggyback off that, saying the question you asked, somebody else around me want to ask the same question, but they too shy to ask it. So what you're
Exactly.
doing, regardless of what you think, you're helping somebody else in the room.
Correct. And that's the truth.
Yeah. Now let's get down for why you are here today.
Right?
All right. What is the Right Health System Marquee Community Health Fair, and why was it created?
All right. So thank you again for the opportunity to be here. So the right health systems, I talked a little bit about Insight Mental Wellness, which is our outpatient practice. We've been around for about 8 years now. Fortunate to be servicing the community, and it's you can look around when it comes to the San Antonio and the environment area. We actually are able to service the Dallas, Fort Worth, Houston, Katy, and McAllen area right now with the Insight Mental Wellness practice. However, one thing we come across are those who don't have healthcare insurance, or even if they do, the premium or the copay or deductibles or whatever can be overwhelming for them. Financially, they're
Mm-hmm.
not able to sustain it. And then we have the underserved areas where they just don't have access. It's so overwhelming. You have sometimes close to two, three, 500 to one provider, and they're not able to successfully manage those patient care. So for us at the clinic, especially after the Kerr County flood July last year, right? We have already been catering to the community in our own little way when it comes to those who are needing mental health services but not able to afford it. So we started the mental health access program, and that was with us here at Insight Mental Wellness. And we started doing pro bono slash sliding scale services.
Mm-hmm.
Now, as you do know, the lights got to be paid, light bills got to be paid, water got to be paid. People have to get their paychecks. And so trying to offer those type of services here at Insight Mental Wellness became a little bit more challenging. Not that it was impossible, but it was challenging for us. So we had to look at the structure and say, how can we efficiently support our community? And one of the biggest challenge that we also encountered was when it comes to community services, referrals, where we champion our own service in terms of collaboration with the community. And so we figured a lot of our patients a lot of times when they are with us are either in that state of crisis. And even though the hospital is a great place to admit a patient to, we know 100% it's never the solution for that problem. Take, for example, someone who's having housing issues, financial problem, food, or employment. They don't need to go to the hospital. Are they depressed? Yes. Were they feeling suicidal? Yes. Are they anxious? Yes. Are they having panic disorders? Yes. But do they need to be in the hospital for those problems, which is the core problem for them? No. Now, how do we address those? We connect them to the resources in the community and we assist them to gain what they are needing, be it in terms of the, food or the houses or whatever. And so after looking at those ways and saying, how can we help these patients? We started providing social services to them. Unfortunately, insurance is always insurance. They got kicked back and refused paying for the services. We appealed, we, reviewed, we tried several ways to see if they would cover them, but unfortunately it wasn't. So the suggestion became, how can we help these patients? We reached out to the insurance companies, and one of the issues that they said was send the patient back to us. Well, they are in a crisis mode. They cannot come to you and wait for you to contact them or call them back in another week or two to get that crisis resolved. By the time you reach them and by the time they get that solution, if they get it, they've already decompensated drastically mental health wise. And whatever we're trying to do, it's no longer even effective. And we're having to start scraping again and scratching from the start. So the team came together and we had to figure out how can we help those people. The right health system was then put together. Our primary focus with the right health systems are on three pillars. One is advocacy, two is collaboration, and three is educating. So we figured if we can advocate for the patient, collaborate with other care professionals and resources, and educate the patient on how to maintain stability, we would have a better community. So Right Health System was birthed late last year. Introducing it to the community, we had the privilege during the Dream Week San Antonio, which just concluded over this weekend. It was about a month long this time, not just a week long.
Right.
And so they had the Dream Health, which we came on as part of that. And this event we scheduled to be at the Botanical Gardens, which I would tell everyone right now, it's coming up March the 8th. It's a Sunday. It's a Sunday, March the 8th. So right after church service and everything, coming out with the family. It starts from 12 o'clock all the way to 4 p.m. We are bringing together resources, professionals. There will be allergy testing, eye checkups, and some other services. There will be blankets and some other clothing, food that will be given out, aside from the healthcare professionals that will be there that day. So all of this will be available to the general public. And then you get to explore the gardens free to the whole family. And there are
Yes.
several things going on during that time. There's a lot of exhibitions during that time at the garden. So we encourage everybody, come with the family, come with friends, come with, anyone that could benefit from a relaxing time. And then there are several community commissioners and personnels who are going to be there as well to share information. So the Right Health Systems Focus, which is the Right Health Fair coming up March the 8th, it's a Sunday at the Botanical Gardens from 12 p.m. all the way to 4 p.m., promises to be a great asset to the community and a great opportunity for the family to enjoy the Botanical Gardens for free while benefiting from what health resources we have in San Antonio and its environs.
I like that. You got
Yes.
everything going on there and stuff. So, let me ask you something.
Hmm.
We know when the fair is taking place.
Okay.
Okay. Who is this event for? Kids, seniors, veteran, working families, and what makes it valuable for each group?
Yes. And as we mentioned, when it comes to community or social services, you're talking about everybody, all the way from infancy or even pregnancy to the golden ages, right? And
Mm-hmm.
so we want to make sure everyone can come in and benefit. You don't even want to get into the giveaways, first of all, which we also cater to every single demographics on there. But for that day, we are encouraging from the kiddos to the adults to the teenagers to the geriatrics, older adults, everybody's going to be there. And we want them to come, not just for the resources and the professionals that will be there to benefit them, but also come out and enjoy the botanical gardens. Come relax. There's food, there's entertainment, and we're hoping that we can get we originally had it scheduled for the 24th of January, which the mayor of San Antonio and the others were already
Mm-hmm.
part of the guest list. We're still keeping that. But the good part is we're now even expanding our view. You can't focus on San Antonio alone, right?
Right.
There are several neighboring cities: Kirby, Selma, Universal City, Schertz, all of these other cities. So we've been in talks with the other cities to say we need to all come together. Healthcare, you like it or not, will spill from one part of the city to the other, right? What you have in San Antonio, I may not have in Selma. What you have in Schertz, I may not have in Universal City. So how can we bring all of this together? So when you come on March the 8th, which is a Sunday. I emphasize that because some people think a Saturday. It's a Sunday, March the 8th, from 12 to 4 p.m. We're telling everybody, come ready to gain a lot. Aside from the food,
Yeah.
fun, entertainment, and everything else, come ready to gain a lot. So there's something for everyone, from infancy all the way through geriatrics.
Oh, wow. Talking about health service. What health services and resources be available on site, such as screening, education, referral, and support programs?
Yes. So we do understand, say, for example, a health professional might say, hey, I can do your eye exam, which we have. There will be a van out there where they're doing actual on site eye exams. We also will be doing allergy testings for those who are, it's already going to be spring by then. So all of that, we want to help, the San Antonio and the surrounding areas to understand what they might be dealing with in that area. And then we're looking to add some others. But that is primarily with healthcare. How about for someone who's saying, listen, I can't keep the lights on in my house. For that reason, some of my prescriptions are going bad because some of them you have to refrigerate. Or, you know what? I don't, right now, I am unfortunately out of shelter. And that means all my prescriptions could either be stolen or lost while I'm out on the street.
Mm-hmm.
And for some, a lot of this medication you have to take with food. Guess what? I don't have anything for breakfast, so I can't take my pills, which means you have to wait
Yeah,
till lunch. And if you don't get that, you don't take that. And some of them, you can't miss those meds.
that's
So
right.
when we say health professionals and resources, that's what we're focused on. We're trying to bring all together. So that way you're not like, well, now you've given me counseling and you're giving me the meds, but I still don't have any house or food. So guess what? I'm still not feeling better, right? So we bring all together and as much as we can try to make sure for every single person in attendance, they have something that they can take home to help them get better.
Yeah, I like that. Okay, oh, I had another question for you, just right up my alley. Oh, here it
Sure.
is. What are the must see parts of the event? Key partners, tables, demonstrations, and sessions.
Yes. So this is a health fair. Remember that. Everybody coming on. And initially in January, we're worried, oh my goodness, it's going to be a little cold. How are we going to do this? But in March, guess what? It's going to be spring already. Sorry. Yeah, it's going to be spring already.
Mm-hmm.
So everybody can come out feeling nice and warm and everything. We have Zumba. Okay. So for those who want to get a little bit of cha 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 into their steps, come on over. There's Zumba activity for that. We have a fitness coach who's not going to be drilling you. When you go to her for personal session, you're going to get drilled. But during that moment, it's more like an introductory, things that you can do to move, get those joints moving. Coach
Hmm.
K kept saying it on Saturday. If you don't use it, you lose it. You don't
Exactly.
lose. And it's the truth. You don't use it, you lose it. Some people say, oh, my joints hurts, my knees, my back. Okay, what type of minimal type of activity can you engage in to help strengthen those areas? We'll do that. And then there's even yoga. However, most likely maybe chair yoga. So that way you're not like, I'm not ready to be flipping my legs up in the air kind of thing. No. And I'll be one of those who don't know
Yeah.
how to flip my legs up in the air either.
Yeah.
But you sit on the chair comfortably. And then we do have our trail walk. Some people always think, I can't go for a walk. I don't know. I don't We have one of the hiking coaches who are going to be there to educate the public on, you don't have to think of a 1 hour walk. No. And
Right.
how do I maximize when I go for those walk, even if it's a 10-minute walk, how do I maximize that? So that way, when I'm going out, I can make sure I'm, doing some things and engaging in proper activities. That's going to be there as well. There'll be our therapy dogs. We have they'll
Oh,
be
yeah.
there just to, help those who like to just cuddle and hold on to the pets and just do that moment. And then there'll be some other entertainment. So there's several activities. And all this will be going on during the whole event. You're talking to people, you're talking to the exhibitors, you're walking the trails, there's the food, there's the entertainment, all of that going on. We just want to make it a fun time for the family, and we're encouraging everybody to be out there on that day, March the 8th. Remember, it's a Sunday.
Yeah, I love that. You push that March 8th, and that's good. Now,
Yes.
we're gonna have kids out there, and you know what kids
Yes.
like? Kids
Mhm.
like giveaway and prizes. So
Ooh.
what type of items are being provided, and how do the addressees qualify?
Okay, so we planned well for this, right? We know there will be several people coming out, and what is another way to really encourage people who are like, I don't know, the prizes, the giveaways. We have anywhere from a Bose here, the headpiece, right?
Mhm.
The headset, to also we have a 50-inch TV. We have, for those who are the health fanatics, the juicer. We have
Ooh.
the air fryer. We
Ooh.
have for our adults the walker. So that way, you can have something to lean on, because some people, it's not about do I need it? It's about, can I afford it? Right.
Right.
And so if you know at this time, hey, I really need a walker because I've fallen twice. And it's such a problem, because if that hips get broken or the joints get broken, then what do you do? So we got walker. For the pregnant woman, we got that comfort pillow where you can wrap around your belly, give you a good support. So that way the belly is not hanging and so heavy on you. For the babies, we have lots of play items for them to be able to get. Everything is geared towards fitness and health. And then we have the blood pressure cuff for those who are curious about, okay, I would love to take better care of myself, but I can't check my blood pressure at home. But I know it's real high. And by the time you get to the ER, it's like 100 and, maybe 200 over 120.
Oh,
That's way too much,
that's way
right?
too high. Yeah.
There you go. And so we have several things, even for the gentleman, hey, I don't need those. I'm a man's man. I need something manly. We got the leaf blower for you. You can get one of those and just go in the yard and boom, blow the whole thing out. So there's so many things and there's so many bikes for the younger kids. Get on your bike, ride the bike around the neighborhood, get active. We have different sizes for different ages. So there's so many gift items that we have ready for people when they come in. And if they check out our flyers, they'll see more information on there.
Yeah. Yeah, and you could just give me the juicer. Don't worry about anything else. I'll take the juicer because I got the air fryer, but the juicer, yeah. Um,
Yeah.
you know what? You gonna have vendors out there and all that.
Yes.
Please pass the information along to the vendors if they want to come on this show and talk about their
Mhm.
product. and
Okay.
more and willing. That's what I could contribute. Also, I could also contribute um, if you want to do a commercial on the show. We
Definitely.
we we um we don't charge anymore. All we do is ask for a donation to our nonprofit. So
Definitely.
if they would like to have a commercial on the radio show or on the
Mm-hmm.
radio altogether that plays all over the place,
Mm-hmm.
just pass that along, and I'm more than willing. I wish I could make it out there. Oh, the way you talking, I can't.
Oh.
I can't turn around and tell these people, nah, forget it. I'm going somewhere else. I'm already locked in.
Well, if anything does changes for any reason, and it so happens to be, guess what? I'm available this day. We'll be more than happy to have you around.
Yeah, I would love to come out there because it sounds exciting and
It
everything.
is.
So
It is.
how can local organization participate as a sponsor, um,
Yes.
and or a donor?
Yes. So for sponsors and donors, so the biggest part for us right now, we were supposed to have 40 exhibitors. We went up to 46. That's how
Oh.
many. And that was because we even had to tell a lot of people no because we had limited space. And we had to be like, okay, we can't have any more than two from this category or one from this category. So there was so many people who wanted to be part of it, which is why we're hoping once we start going into the neighboring cities, Kirby, Selma, Universal, and the
Hmm.
others, we'll be able to, replicate what we have here and, do them in all these other areas. So in terms of exhibitors, we may not be able to take at this moment, except for those who are able to physically do like a assessment or treatment or whatever to patients on site. We may be able to make an exception and find a way to accommodate. But unfortunately, we can't take exhibitors right now. Now, for sponsors, we are open to those because the Right Health System, it is a 501(c)(3), which means every single cent that you donate or contribute to us, they are all tax deductible. Right?
Mm.
So you don't have to worry about, oh, I don't have the money. And remember, it's for a great cause. Our focus is to be able to help the community, not just in terms of mental health, but to be able to advocate for them, collaborate with other specialists, and also educate them to maintain stability. And this is what you will be supporting. You can actually, anyone who's open to this, either to sponsor us or to donate to us, you can reach us on our website, which is www.righthealthsystems, and it ends with a S. The systems is emphasized because it's not just one structure we're looking at. We're looking to collaborate with others. So that way we can bring everybody together. And so righthealthsystems.com is our
Mm.
website. You can see more about us. You can learn more. You can also give us a call or email us on our website. It has all of our information. Info@righthealthsystems.com is our email address. Now, one thing that we are doing from February 1st, which was yesterday, till March the 1st, is that for everyone who's willing to go to the South Texas Blood and Tissue Donation Center to donate blood or whatever within between the dates of February 1st to March the 1st. They can actually stop by our location here on Parent Vital, and we will give them, so long as they have proof of donation at the South Texas Blood and Tissue, they can bring us a proof of donation, blood, or whatever they did, and they would get two rodeo tickets.
Oh.
Yes, they would get two rodeo tickets. So they need to stop by the clinic. The address we have is 10807 Perrin Vital Road, Suite 300. And that's 10807 Perrin Vital Road, Suite 300. And that's where we are. It's in San Antonio, Texas, 78217. Come on over, just bring a proof of your donation, and you receive two. Now, you have to also tell them, hey, I'm coming on either behalf of the Right Health Systems, or you know what, even if you don't tell them, just go and donate. Bring a proof that you did it between the dates of February 1st to March the 1st. Bring that proof to us. You will get two San Antonio, and I have the flyer here. It's a San Antonio stock show and rodeo. So you
Okay.
can go watch
Boy,
all of those activities for free on us.
look at you. You're a salesman too. I like that. So let me ask
Hey,
you something. What
yes.
does success look like for this fair? What impact will you want it to have after March 8th?
Yes, a success with this fair would be an opportunity for us to promote number one, mental health awareness. A lot of people, unfortunately, shy away from talking about their mental health concerns.
Yes.
Oh, I don't want to talk about it, especially for us in the Black community or Hispanic community or Asian community. And then, most especially for our men, they don't want to talk about mental health.
No.
And the suicide rate is there in the numbers. The daily impact, if you look at the impact of mental health in our community, for someone who's feeling depressed and don't feel like going to work, can you imagine what that impact is on their workplace, co-workers, customers, and the overall cycle that it would impact for them, financially for them as well? For someone who's having panic disorder, so these are things that we want to say, don't shy away from them. You are
Mhm.
human. And I educate people to say mental health is called mental health disorder for a reason. It is out of place. Can we help you get it back in place
Mhm.
and get you stable again? But if you don't talk about it, you don't speak up about it, how is that going to be possible? So we encourage everyone to come out. And most importantly, our focus in advocating, collaborating, and educating the public will be more than fulfilled when we can have all these people out there who can gain resources on that day and benefit from what they have in the community and learn to take that little stroll around the garden, de-stress, enjoy that little moment of, relaxation. That's what we're looking for. And success definitely will be for us to be able to replicate this in the neighboring cities around San Antonio.
Right.
So that way we can, promote more awareness and collaborate with more professionals and resources.
Okay. One last question for you.
Mhm.
If someone can only take away one thing from this event,
Yes.
what do you think it would be?
You're not alone. You were not alone. We are here for all you have to do is ask, period. A lot of even some providers, oh, you need a referral for this? I don't know anybody, but they're all over the community, which is why
Yeah.
we are forming the Right Health Systems Community Health Directory. And we want to do that because if you see some of the community directory we have right now, either might be only to a certain specialty or only to nonprofits. But you have to understand the community needs everybody. So the
Yeah.
Right Health Systems Community Health Directory is going to be targeting also not just San Antonio. We're pulling all these neighboring cities together: Kirby, Selma, Schertz, Universal. All of them, we're putting them in one directory. So that way everybody can gain access to them.
Oh, wow. A lot of
Yes.
information, a lot of information. So,
Yes.
closing out, tell
Mhm.
everybody again how they can donate and help out your cause.
Yes. So once again, the Right Health Systems, it's a 501c3 nonprofit organization. Our focus is for mental health care while collaborating with other healthcare professionals and resources to benefit the community. If you wish to join us, first of all, I would say the biggest contribution you can do is make this known to everyone you know, family,
Hmm.
friends, all. March the 8th at the Botanical Gardens from 12 p.m. to 4 p.m. It's a Sunday. It's absolutely free to the community. We encourage family members to come together, friends and all to come together. However, if you wish to financially support us, which we would truly appreciate, our website is www.right, which is RIGHT, health, HEALTH, systems, systems.com. Righthealthsystems.com. We have all the information you can access on there. And if you want to reach us by email, it is info at righthealthsystems.com.
Wow. I love it. I love it. I love it. All
Thank you
right.
so
We
much.
appreciate you coming on board. Don't you go anywhere. I'm gonna sign
Definitely.
off. Don't go anywhere yet. But
All right.
thank you for coming on today. And one thing you could do for me, can you send
Yes.
me all that information? So
Yes.
when I go ahead and edit this and get it out there, I'll send you a copy of this so
Yes.
everybody also know how to get a hold of you. Because some people are visual, some's got
Hmm.
to see it on paper.
Yes. Yes.
So if
Yes.
you can do that for me, I would deeply appreciate it.
Definitely. Thank you so much. We truly appreciate this.
All right, thank you.
All righty.
Hold tight. I'm checking to make sure that we're off air. Okay, that's off. I have to go and check everything.
Makes sense. They'll be like coughing and laughing, and everybody, what's going on over
What's
there?
going on over there? What's happening? So I just always double check to make sure.
Like they having the after party.
Yes, right. And I wasn't invited.
Yeah.
All right, we'll officially you off. So I'm
Awesome.
a, I am impressed.
Thank you
I
so
know I
much. I
know
truly appreciate the
I know I
opportunity.
talked to you for just a little bit, but
Yes.
um I've been gifted with born with things and I can see things that people say, how do you see that?
Mm,
When we
mm,
first talked to it, when I first talked to you,
mm-hmm,
at that time, I felt the chemistry there that we could sit
mm,
down and have a conversation and we'll be on one accord.
mm-hmm,
And you
mm-hmm.
know, the great thing of having the interview is you have that chemistry going on and
Mm,
understand what that person is doing.
mm-hmm.
Now, every interview I do, I learn something new.
Okay.
And for you being where you are, I I want to collaborate with you. Um, with me being the only person with this radio station,
Okay.
I wish I could say I could send you money.
Well,
I wish I could do that because you make me want to send some for you. You see right
we
there.
appreciate that.
But I could do other things for
Okay.
you. Like I got the radio station, I got a
Mm-hmm.
PA system. Whenever you get
Yes.
something you need, music or
Yes.
something, or all that right there, I'm there for you, and I'm gonna throw my hat
Yes.
in the ring to
Mm-hmm.
really help. Because what you're doing is so important in the community. It's
Mm-hmm.
almost like you're filling the holes in the community that people don't see. You filling that
Yes.
hole with the resources and everything, and that's what
Yes.
we need. Because I always talking about the problem is nobody know where to go for resources,
Mm-hmm.
and
Mm-hmm.
that is really my pet peeve. They're
Mm.
out there. I don't want to call them lazy,
Mm.
but I just did, so I'm gonna call them lazy. It's because they too busy having their hand out without looking.
Mm.
You know, you have to look. It's not going to knock on your door and say, "Hey, I got a resource for you to help pay your light bill."
Mm-hmm.
But you
Mm-hmm.
have to get out there and get involved in what you're doing right now is
Mm-hmm.
reaching the people. And
Yes.
when you said you went up on your vendors, I mean, that's
Yeah.
unheard
And
of.
we actually had to cut because there were so many people who wanted to be there. And we
Yeah,
were like, we can only take 40, but we had to push 46. And we're like, oh my God. Even at
man.
46, we had to be like, okay, only two. We can only take two from this category, two from this. Everybody else, sorry, sorry, because it makes no sense when we have like six people from one category and then we don't have the other variety. So it
Right.
was hard, even with that. Yes.
Yeah, I agree. And you know what? I'm gonna be honest with you. This is my first time hearing about that is when I met you Saturday.
Oh, wow.
I did not
Wow.
hear about this. See,
Wow.
and so
Well, I'm glad.
I'm like a sponge. I want to absorb all this out here, and relay
Hmm.
it back to the people. So
Great.
what I'm gonna do for you is not only
Hmm.
that I'm going to do a Facebook post on it, I'm
Awesome.
actually gonna do a commercial for you.
Oh, well, thank
Yeah,
you.
I'm gonna do a commercial for it. I'm get working on that commercial after I come back from the gym.
Okay.
I'm gonna put everything together and get a commercial. I'll send it to you before
Okay.
I air it
Okay.
so you could approve it. But
Yes.
about the event coming up because
Yes.
that's what I'm gonna do.
I appreciate you, Ronald. Thank you so much. And I would tell you this. I know every time I tell God, I say, whatever you do, just make sure you're leading me in the right path, period. Because I
Hmm.
don't know, but now, even now is not guaranteed, right? I
Right.
only see what's happening in the moment. You know what the full thing is. And so when the event was postponed on January 24th, I was like, oh man, because I've been looking at this since November last year. And we were looking at the weather, and the weather was you could see Fridays that day, the day before was so
Yeah.
perfect. And that was what the picture was supposed to be for that Saturday. So when it so happened, I said, God, you know best, right? You know
Hmm.
best. You know why you're moving this. I'll let you do you. And so we were looking at the next date. The mayor was already on board. The mayor for Kirby was there. The mayor for Universal City, the mayor for Selma. They were all like, yes, we're going to be there. We want to do this in our cities as well. So we're like, yes. And then boom. I said, you know what?
Yeah.
I'm going to let you do you. And whenever you're ready, just let me know. So I'm glad I came up and met with you as well. I believe I would love to collaborate and see how, because I'm in a phase. One part of my entities that I did not mention was the Phoenix Management International. We do
Hmm.
business management. We do consulting. We do advisory, and we do business acquisition, basically brokerage. So there's
Yeah.
several part that I also cover in that area. And I think there is an opportunity for us to, if we can, sit down together and review and see how we can work together, right?
Okay.
Even beyond here. And when it comes to supporting, I've always enjoyed that. I'm always big in the community, especially either through the Insight Mental Wellness or through the Right Health system or through the Phoenix Management. We do that. I still want to promote, especially my school, which is the Pinnacle Career Center. So there's several
Oh.
things that we could work on. I would love other opportunities to talk about the different entities.
Hmm.
So that way it's not just like, okay, one multiple that I'm having to talk on. So I would love opportunity to say, okay, I want to focus today on Pinnacle or Insight or whichever one that we have to talk about. I
Yeah.
would love that opportunity. And I would love to share also with the exhibitors that we have, because that's about 46 that can come on air with you
Hmm.
and broadcast. And I don't know, does this air today or when does it go live? Was it live already?
It's already live.
Okay,
You can
great.
see. But what I'll do, I'll edit everything,
Hmm.
and I put it on my YouTube channel, and
Okay.
that's why I need to have your information. So I put that in the description, so
Yes.
everybody know how to get a hold of you and all that good stuff. So
Yes.
I'll get that together. Let me
Hmm.
ask you something, because somebody asked me that question. Somebody asked me the
Yes.
same question I'm getting ready to ask you.
Hmm.
Sometimes I do two, three, four events in one weekend,
Hmm.
and they look at me and say, "When do you get sleep?" And I'm gonna ask you the same thing. When do you get sleep?
So interesting enough, on Thursday was my birthday,
Oh, happy
and
birthday!
thank you. I was out and about first thing in the morning and at one of the programs that they had. And from there, I was at the office. From there, I was at another event. And someone was like, "It's your birthday. What are you doing?" I said, "Do you understand what my title is? Entrepreneur." I'm up from today, I was up from 2 a.m. I did some stuff all the way till about 6. I went to sleep, woke up at 7.
You know,
So,
you know, me and you both are Aquarians.
hey,
Cause
when's your
my
birthday?
birthday was January 21st,
Oh, look at
and
that.
I'll let you guess my age.
Well, I am horrible at guessing age. When I say maybe, I don't know. I'm horrible. I'm horrible.
Just pick a number.
um, I say at least maybe early 50.
Oh God, Yeah, I would
Did I
say,
go too far?
I would say flattery will get you nowhere.
Oh,
Um,
okay. No, but
I
at least
I just turned 71 years old.
what? So see, I told you I'm horrible, but no, you don't look at it because my mom's 75. My
Mm-hmm.
mom's 76. Yeah, she just turned 76. You
Yeah,
don't look it.
I stay
Well, you look
busy.
great.
Thank you. I
That's
stay
great.
busy. I stay busy. And meeting people like you, energizing, uplifting, positive,
There you go.
and a lot of people don't realize that.
Hmm.
If you hang around a crowd that's positive, the sky's the limit.
There you
But if you
go.
hang around somebody negative, they constantly trying to bring you down to their level.
There
And
you
once they
go.
get you down to their level, they leave you
Mm-mm.
alone because they did their
Mm-mm.
job.
Yeah. Yeah.
If I inkling one, just inkling something negative, I'm hanging around
Mm-hmm.
somebody. Oh, I cut them.
Mm.
Done.
I met a young entrepreneur and she was telling me, I said, what do you do? She said, I'm a serial entrepreneur. She said, I know, don't look at me. And I said, what do you mean? And she said, because people always tell me serial entrepreneur, it means you're doing nothing or it means you're just not sure of what you're doing. And I had to sit her down and say, never let anybody dismiss what you do and why you're doing it.
Exactly.
Because if they can't, don't mean you cannot,
Exactly.
right? And the fact is you just have to focus. So for me, I work with different things, different ways, and my focus will always be I want to make sure I'm excelling in how I'm working. So
Yep.
that is me, and I don't nobody bring their own negative. Don't do
Mm-mm.
it. Don't do it.
It's so funny when I set up and all that stuff, and then when I break it down, people watch me and
Hmm.
they said, "Well, why are you doing it like this? Why are you doing it like that?" Because I have a system, I have a routine. This is what I do.
Exactly.
Because
Exactly.
when I pack everything, it goes in different bags, and
Hmm.
once I unload everything in the garage, I don't have to look around for anything. It's
But
sitting right there.
exactly.
I put
Hmm.
everything, and that's how somebody watched me one time said, "You are very particular about." I said, "I am." I said, "Do you own a business?"
Hmm.
He said, "No." So, what if I came to you and told your routine at the house, and I say, "Why do you do that?" You probably
Hmm.
get upset for me questioning you.
Exactly.
I'm not getting upset that you're questioning me, but you
Hmm.
got to look at this is what I do for a living. And
Hmm.
I want to make sure everything is right when I go out. Somebody could call me today, say, "Ron, we need you out here." I load all my stuff in my truck and
And go.
boom, and I'm
There
there.
you go. There you go.
It's
Now,
just,
do you have an office space that you use as a studio right now?
yeah, my house.
Okay.
Because,
Well, the reason I bring that up is right now we are building out our 7,500 square foot space here at the
mhm,
clinic. There's a space that we're building out right now, and we're making it a co-work. And that's why I said we can work together if you're open to it. You know, there's several opportunities we could collaborate, and we're doing it as a co-work space. And one of the things I've been wanting to do was to have a mini studio where we could have those people who have their small businesses can either go in there, do a recording session, or so I've been
mhm.
wanting to convert one room to fully a studio, right, where people can
Okay.
come in and do their own thing. And so the other part of it we have is a whole conference center where
Mhm.
we can sit. I don't know how many we even put on there as a number, but it's a big old space where people can come in and either have a conference, and we have an outdoor space that it flows into. So there's
Yeah.
several things that we could definitely work on that I would love to discuss with you if
Yeah, you
that's
could do that.
possible.
Well, last year this time I did have a studio, but I got sick.
Oh,
I couldn't walk for 3 weeks and found out I was a tendon in my foot. So it
ooh,
was either pay my medical bills or pay the
mm-hmm,
studio. Well,
mm-hmm.
guess who won? The medical
Ah,
bill.
the medical bill. I
So
know,
I had
I
to give
know.
that studio up,
Mm-hmm.
and that really hurt my heart because I was really
Mm.
just getting going with everything. Things was going just right, but now I'm at a time and place right now that I'm ready.
All right. Well, if
I
you
gotta
want
do it
to,
again.
I could bring you by whenever you want to, and we can
Okay.
take a look at the plan that they have, so that way we can make some recommendations on how to build it out, if possible, into a proper studio. So
Okay.
if you want to use it or someone else, it's not going to be overbearing when it comes to finances, or as it would be collaboration, we can work that out together.
Okay. Well, definitely put let me know.
All righty.
And I'll be free. I'm free to anything. Sit down and talk about it. That's what communication is the key.
It is the key. It is the key. And so if you know your schedule is available, well, they haven't started. They just got permits pulled with the city.
Hmm.
So I can't say that we have right now opportunity for you to see what we have, but there's a plan that we've pulled out and everything. So if you want to just come take a look, or if you want to wait till when they start construction, that can be your call. In the
Okay.
meantime, what I'll try to do is I'll talk to the exhibitors that we have for that March event and see. Do you want me to give them your contact directly, or do you want us to coordinate so that way it's not chaotic and you're like, where are you
Uh,
calling from and stuff like that?
you have my calendar link, right?
Yes.
Share that with them. That way we can make contact that way.
Okay, so
Yeah.
we'll try to coordinate that with them and we'll see if we can get them. The other part is if we know when they'll be coming on, like today, I would have loved also to put it on my Facebook and social media so that way we can encourage people to listen in and that
Yeah.
way you can build more listenership for
Well,
the
let
for
them
this.
know when they do that. Give a
Mhm.
week notice.
Yes,
Give a
yes,
week because
yeah.
I woke up this morning. I said, "What?
I
Dr.
don't
Gloria
joke.
coming
Don't,
on?
that's me.
Doctor ain't playing." I looked
Once
at that
I
and
don't, if you gave me yesterday, I would have taken it yesterday.
and then I
So
turned
that,
around and I made sure I send you the link and everything.
yeah.
And it's so funny on my morning show. And I said, "Y'all, we're in for a treat. we
Mhm.
got Dr. Gloria coming on today
Yeah.
at 11 a.m." So I was able to push it out that way
Hmm.
and
Hmm.
everything. But yeah, I feel good about doing some things together.
All righty. All right.
So
So you let me know what your availability is. If you want me to go on your calendar again and try to find the time so that way we can schedule something, that'll be great as well.
yeah, probably go on my calendar again.
Okay. I'll
That
do
that
that.
that probably be the best bet
Okay.
and everything. So see once it's on once you do that in my calendar, it goes
Hmm.
directly to my main calendar.
Okay.
So it's instant. So I can look at my calendar all the time and somebody said,
Hmm.
"What's your availability like this weekend?"
Hmm.
Somebody asked my availability for some days. I'm sorry. I'm all taken care of. But what if I pay you double? I said, if I
Oh.
was younger, I'd probably say yes, but
Hmm.
no, not. I won't do that to anybody ever
Sure. Makes
because
sense.
their time is precious, so is mine. So if somebody got me booked, they got me booked.
Yeah. All
Oh,
righty. Well, I'll do that.
I'm gonna give you an open invitation on February 21st.
Okay.
That's
What's going
that's
on?
that's on a Sunday.
Hmm.
Where I'm at every Sunday is at A Chicago Bite, where we do the gospel brunch.
Yes.
We
I saw
are
that.
we are doing rebuilding Black Wall Street one vendor at a time.
Okay.
And we opened the door. She could handle 7 vendors in there. Within an hour and a half, it was already booked.
Okay.
And then
Okay.
turn around, she booked for March 14th. It's already done. So
So
they're getting
February
there.
21st.
And then I'm gonna send you a link because I'm doing my second annual fundraiser for the radio station.
Okay. All
So
righty. Send that to me too.
I'm doing a lot of things. I'm staying busy.
That's good.
Did you get my did I send you the link for I was nominated for a Community Impact Award?
No, but I know I'm looking at the one where you're having the 12th anniversary coming up on March the 15th.
Yeah, that's my fundraiser.
Yeah.
But
Okay.
but but this one is in May. I'll send you information on that
I'll appreciate
and
it.
everything. And send me any information that you have for any one of those hats that you wear
I know, right?
that's
I
going
know. I'll
on.
share them
And,
with you.
and let's help push this out so everybody know who you are.
All righty.
Okay?
Thank you again. I appreciate you, Ron.
All right, we'll talk to you later.
All righty. You take care.
Okay, bye.
Bye-bye.
Thank you for tuning in to WSAN Radio. Catch us on our YouTube channel, WSAN Radio SA. Subscribe to our channel and hit that notification button.